Hello and welcome to Pregnancy Info. Whenever you are pregnant and you see some spotting or bleeding, then you gone afraid. Spotting or bleeding during pregnancy can be alarming, but it doesn't always mean there is a serious problem. The causes of bleeding vary depending on the stages of pregnancy. Some instances are harmless, while others may indicate complications that need medical attention. Here is a month-by-month guide to spotting during pregnancy, its causes and whether it is dangerous for a baby or not. First month, week 1 to 4. Causes: implantation bleeding. Light spotting occurs when the fertilized egg attaches to the uterine lining around 6 to 12 days after ovulation. Hormonal changes. The body is adjusting to pregnancy hormones which may cause light spotting. Cervical sensitivity. Increased blood flow to the cervix can lead to spotting after intercourse or a pelvic exam. Is it dangerous? Implantation bleeding is normal and usually harmless. However, heavy bleeding with severe pain could indicate an early miscarriage or an ectopic pregnancy when the fertilized egg implants outside the uterus. Second month. Causes: miscarriage. Unfortunately, many miscarriages happen during the first trimester, often due to chromosomal abnormalities. Ectopic pregnancy. If spotting is accompanied by sharp pain on one side, dizziness or shoulder pain, it may indicate an ectopic pregnancy. Subchorionic hematoma. A small collection of blood between the placenta and uterine wall can cause spotting. Is it dangerous? Light spotting may not be concerned, but heavy bleeding with cramping should be checked by a doctor immediately. Third month. Placental development and cervical sensitivity. Causes: cervical irritation. Increased blood flow makes the cervix more sensitive, leading to spotting after intercourse or a pelvic exam. Placental issue. Early signs of placenta previa, where the placenta covers the cervix, or a subchorionic hematoma may cause spotting. Is it dangerous? If the bleeding is light and not accompanied by pain, it is usually harmless. However, heavy or persistent bleeding requires medical evaluation. Fourth month. Second trimester adjustment. Causes: placenta previa. The placenta may still be covering the cervix using painless spotting. Sexual intercourse. Increased blood supply to the cervix can lead to light spotting after sex. Cervical polyps. Benign growths on the cervix may cause mild bleeding. Is it dangerous? Most causes of light spottings are not harmful. However, bright red bleeding should be checked to rule out complications. Fifth month. Causes: placenta previa, if still present, can cause spotting. Cervical changes. The cervix is softened and preparing for later stages of pregnancy. Uterine growth. Rapid stretching of the uterus may cause some minor spotting. Is it dangerous? Spotting without pain is usually not concerning. However, bleeding with cramping or pressure may indicate preterm labor or cervical insufficiency. Sixth month. Causes: cervical irritation from sex or medical exams, minor placental issues like a low-lying placenta, uterine stretching and pressure as the baby grows. Is it dangerous? Generally, light spotting is not a problem, but any heavy bleeding, especially with contractions, should be evaluated for preterm labor. Seventh month. Causes: preterm labor. If spotting is accompanied by back pain, contractions, or pressure, it could indicate early labor. Placental abruption. A serious condition where the placenta separates from the uterus, causing heavy bleeding and pain. Is it dangerous? Yes. Any bleeding in the third trimester should be reported to a doctor immediately. Eighth month. Causes: blood show. Light spotting mixed with mucus may indicate the body is preparing for labor. Placental abruption. Partial or complete separation of the placenta can be dangerous. Uterine rupture. Rare but serious in those with previous C-sections. Is it dangerous? Light spotting with mucus may be harmful, but heavy bleeding requires immediate medical attention. Ninth month. Causes: bloody show. A sign that the cervix is dilating and labor is approaching. Labor contractions. If spotting is accompanied by contractions, labor may be starting. Placental abruption can occur at any time and requires emergency care. Is it dangerous? Light spotting before labor is normal. However, heavy bleeding, severe pain, or decreased fetal movement requires urgent medical attention. when to call the doctor. If spotting turns into heavy bleeding, if bleeding is accompanied by severe pain, dizziness, fever, or contractions, if you notice decreased fetal movement, if you have history of pregnancy complications, spotting during pregnancy is not always a cause for concern, but it is always best to consult a doctor for peace of mind and to ensure the safety of both mother and baby. Must share this information with other pregnant women that they can understand why this bleeding or spotting occurring during the pregnancy and is it dangerous for her or not. Thank you.